Hi, everyone, and welcome to the show. Today, I have a special guest with me. Her name is Jaren Soloff, and she is a registered dietitian and international board certified lactation consultant who serves as an expert in women's health. While continuing to practice in the field of eating disorder treatment, Jaren gained additional experience as a uh, international board certified lactation consultant to fuse her love of nutrition and women's health. Now she works in private practice and combines her expertise as a nutrition therapist and lactation consultant to support mothers in nourishing themselves and their babies with confidence. Full Circle provides nutrition counseling, lactation, I guess it's uh, lactation consultations to help both mom and baby thrive in motherhood. Informed by her own journey and the hundreds of women she has counseled, Jaren's experience comes full circle to support women in navigating pregnancy, birth, and postpartum from a simple and intuitive framework. Welcome to the show, Jaren.
Thank you so much for having me.
Am I pronouncing your first name correctly?
You
Okay.
are. Mhm.
Awesome. So, I don't think this topic is something that we usually talk about a lot in terms of eating disorders. And yet, eating disorders coincide with a woman's reproductive years. So it is a really important topic. And there may be people listening whose eating disorder, got worse after pregnancy, or they relapsed during pregnancy or after, et cetera. So I want to start by just talking generally about what the role is in nutrition, both before someone conceives, during pregnancy, and then in the postpartum era. Because I know, I speak a lot on neurobiology, and I know brain development is severely impacted by nutritional intake even before you get pregnant. So can you give us just a little brief nutrition and pregnancy 101 talk?
Absolutely. I could talk about this stuff in my sleep. So the preconception time is really kind of that time where we're setting the framework and the base for the pregnancy and even the parents' postpartum experience and their ability to heal from birth. So some of the basics that really come to mind for anyone entering into that phase is making sure that your nutrition and your stores overall are adequate. So certainly in the context of an eating disorder, but just generally, it would be, making sure that you're having a good combination of different macronutrients and micronutrients. We talk a lot about folate specifically for women of childbearing years, just because that has such an impact on the early few weeks of a pregnancy. So the recommendation is typically that if you are in those childbearing years, to have some kind of folate supplement throughout that time. And of course, you can get it through your diet as well. But we're really focusing on the first year before pregnancy and planning them, that you're getting a wide variety of foods and a amount of nutrients from preferably a whole foods diet, and then some supplementation if needed as well.
Are there any ways in which poor nutrition can increase the child's risk for an eating disorder after, as they grow?
Interesting. So I think of what's coming to mind is undernutrition and irregular, erratic, nutrition. And that might show up if the parent has an eating disorder. I think we more so see it in patterns of pregnancy in terms of low birth weight or
Mhm.
preterm delivery. Sometimes the parent's healing postpartum can be impacted if there have been eating disorder behaviors. But in terms of specific nutrients, I'm thinking of more so the overall pattern of nutrition and health that can really
Okay,
be impacted.
sure.
Mhm.
So, how do you prepare? Let's shift to talking about a woman who either has an eating disorder or has a history of an eating disorder. And what are the kinds of things that you would be looking out for, or that you commonly see in that when they become pregnant?
Mhm. So, pregnancy is a time, I think, throughout any woman's life where, if you have a history of an eating disorder, or if you are still struggling in some way, it can feel really intense with the amount of triggers. There's a lot of awareness around nutrition. We think about, trimester by trimester, there's conversations around, what you should be eating, what you shouldn't be eating, which is intended to be supportive to help
Yeah.
the fetus and your baby grow. But when you're in recovery, those can feel very intense.
Mhm.
So there's also a lot of focus on weight gain during that time. And we hear, specific numbers around ranges, which again are intended to be helpful. But depending on your history, of where your weight and nutrition have been prior, that can also be, a point of intensity and a trigger as well. So some of the things to kind of look out for are really noticing some urges or changes in food behavior. Appetite might change as well. Hormones are changing during that time, and that can affect mood and appetite together.
Mm.
There might be changes in your relationship during that time as well, because it's a huge life change. So there can be a lot of vulnerabilities that we know can trigger the reoccurrence of eating disorder behaviors during that time.
Right. I also think about body image because in pregnancy, there are so many changes in a woman's body. And I
Mhm.
think that can be very triggering to a woman who has body image issues. Do you see that as well?
Absolutely. And I often see it, not only during the pregnancy, but this is something that if an individual is contemplating growing their family and knowing that pregnancy is a time where you are going to have to experience weight gain.
Right.
And that can feel so tricky because that's a really common fear in eating disorders and through recovery, that, your body is going to change and your weight's going to shift as part of that.
Well, what about women living in larger bodies and they are getting when they get pregnant, may are doctors recommending again more weight loss or how is that? How do you handle that?
It's so tricky, but it's a really great conversation because there's a lot of weight stigma in the fertility and the pregnancy space.
Mhm.
So the kind of standard medical recommendation is that individuals may use the BMI, which we know is not a great marker at all for measuring someone's health, but they use someone's BMI to determine how much quote quote weight they should gain throughout the pregnancy. So individuals who live in larger bodies are expected to not gain as much during a pregnancy, which,
Which seems a little bit unfair because
yes,
basically you're saying you have to be on a diet, which
right,
is, the worst thing in the world in some cases. And then to the person who's at the other end of the spectrum, you're saying you have to do the hardest thing that's for you, which is to gain weight. So
right.
it's a tough time if you are pregnant and you have an eating disorder, right? I
Mm.
would think.
Absolutely. And depending on, unfortunately, we know that it's pretty uncommon to have, some medical providers that are going to be understanding of the unique circumstances of having a history of an eating disorder and what that might mean for you during pregnancy and having these conversations around weight.
Yeah. And I would think that those some of those conversations actually may trigger relapse so that someone with anorexia may start to restrict or have the urge to restrict. And, someone who's maybe has binge eating disorder may have the urge to binge with those kind of conversations. It's kind of like it's a cat and I mean, not a chicken egg kind of thing. If you don't have the conversations, then I know patients are always thinking about their bodies and what they're eating and should they be gaining weight or losing weight, all of that stuff. And I don't know how do you navigate that as a dietitian,
Mhm.
to keep it from being a triggering conversation.
Mhm. Well, ideally, these clients are working, these individuals are working with a treatment team if they're noticing that these urges or these symptoms are starting to intensify or reoccur. And that might include, taking blind weights at their physician's or their midwife's office, doing different measurements in terms of growth and development. um, for the growing fetus during that time. So there's some different ways that we can be mindful of someone's experience as they go throughout the pregnancy that don't include focusing on weight.
Good. Yeah, that's excellent. What about perinatal mental health and nutrition? How do you conceptualize what needs to be done there?
Oh, it's huge. And I think it's a piece of our field that I'm hoping will continue to grow and expand. I think we're just now tapping into understanding more about postpartum mood and anxiety disorders, and we're bringing a lot of awareness.
Mhm.
But we're also finding some literature and research to show that, someone who has experiences of postpartum mood and anxiety disorders, who also might be in eating disorder recovery, is going to be more at risk for a relapse during postpartum, which
Mhm.
makes a lot of sense, I think, to
Sure.
us as providers when we're doing this work, day in and day out. But I think we still have not gotten the message to understand that postpartum is actually a very vulnerable time for someone to be at risk of a relapse. So we think about how we educate our clients on, okay, here are the times in your life of big transition or big stressors that can be high risk times for relapse. Postpartum is one of them. There are huge hormone shifts.
Mhm.
It's a huge just life change overall.
Mhm.
Your body is depleted of nutrition,
Mhm.
and there can be a lot of mood shifts that occur in response to some of the hormonal changes or the birth story that happened as well.
Yeah, because a lot of people get their expectations up that they can control, what happens during the birth, and that, it's kind of one of those best laid plans, often go awry because it doesn't always go as they feel that it should. And postpartum depression, especially for an older mother, is an issue too. Is that something
Mhm.
you see a lot of?
I think we are seeing just more identification of postpartum depression overall.
Mhm.
But certainly when there's several different risk factors, but even thinking about, retrospectively, I think a lot of us might think now like, oh, I was probably experiencing postpartum depression. I didn't even know it because we weren't talking about it, or I didn't know how to identify it at that time. So
Yeah.
yes, I think we're understanding and recognizing a lot more of it.
Yeah. What do you recommend for patients who've had eating disorders who are struggling with fertility issues? Does nutrition have a role to play in that?
Absolutely, a huge role. And again, it's such a tricky balance because, many individuals who are struggling with fertility are introduced to a large body of information around nutrition and fertility. And often that can have a lot to do with weight. It can be very saturated in diet culture. But if someone is specifically in recovery from an eating disorder, we know that there can be, amenorrhea that might be impacting fertility. And so, weight gain or weight restoration could be part of that process.
So
Um,
that's when someone loses their period because they may have anorexia or bulimia.
that's right.
Yeah.
Yes.
Hmm.
Yep. Can't talk. Amenorrhea is this like female athlete triad, but
Hmm.
not having a regular menstrual cycle because of inadequate nutrition or over exercise. So nutrition can play a huge role in terms of getting more restored in terms of weight or nutrition. Outside of that, we know that infertility is now impacting 1 in 8 women.
Wow.
So it's becoming more prevalent overall, and some of the nutrition strategies might include working towards a more anti-inflammatory diet and style of eating,
Mm.
which kind of models a Mediterranean style of eating. So complex carbohydrates, lots of monounsaturated fats, a variety of different protein foods,
Mm.
and of course flexibility and variety.
Mhm. Good. Well, what is the most difficult client that you find to work with? And I would like to also include in another question about the lactation experience in women with eating disorders. So you can pick which one you answer first.
Mhm. A difficult client. I mean, I feel that it almost has like a negative connotation, which I don't think you're intending, but difficult in terms of the layers of,
Well,
what they may
let's call
be
it
experiencing.
complicated then. Let's call it
Complicated.
complicated. Yeah.
Mhm. I really do feel it's so complicated for individuals that are navigating infertility and eating disorder recovery. And it's because I think both of those experiences individually are so impactful on a personal level, right?
Yeah.
And to have the complexity of being an eating disorder recovery and also have so many unknowns of infertility can just be really heart wrenching. So I have a lot of compassion for individuals that are in that space.
Okay. And then what's the lactation consulting experience like with women with eating disorders?
Hmm.
Because again, that touches on the body image piece, you know?
Right. Yes, it can, because during lactation um, there can be weight preservation and energy storage that the body is trying to move towards in terms of adaptation and trying to protect and make sure that the mom has adequate stores for the baby.
Hmm.
So this is, one of the big kind of conversations of postpartum is a lot of individuals are really concerned with weight loss or getting their body back, feeling like themselves. And so there's a lot of these messages that our body is really trying to protect us during that time to make sure that our babies can be fed, and that might result in weight being retained during that time. So that can be a challenge. There can also be challenges just with the feeding relationship between mom and baby. There's a lot of messages around, thinking that we have to have perfect diets as mothers in order to breastfeed.
Yeah.
And if we have a history of black and white thinking, or complicated relationship with food, that can feel very intense and triggering, for wanting to try to breastfeed our baby.
Yeah.
And the last one that I'm thinking of that I see really commonly in the lactation world is there's a lot of conversations around infant food allergies or intolerances now.
Hmm.
And so pediatricians are often very liberal with, having moms do elimination diets, eliminating dairy, eliminating certain types of foods. And you can imagine, for someone in recovery, that can be, very sensitive because the mom has to restrict her diet. And it's usually not indicated. It's usually actually very uncommon for babies to have a true allergy to something in mom's diet that's being passed through her milk.
So it's not uncommon for babies who are eating real food to have some food allergies, but you're saying if they're just on breast milk, it's unlikely that what the mother is eating is going to cause a food sensitivity.
That's
Yeah,
right.
because it's nature's perfect food, right? That's what
Right.
they say.
Yes. Our bodies, they're incredible. And, the level to which it passes from a mom's diet to the baby is very, very small.
Yeah. Okay. Good. Is there anything else that that I haven't asked you about that you'd like to mention before we end the podcast?
Hmm. I hope I just reiterated, that if someone is in eating disorder recovery, or, even if they don't have that experience, I've had many individuals come to me that, because of their experience throughout pregnancy and postpartum, actually prompted the start of disordered eating or a complicated relationship with food. And I think it can feel really surprising.
Mhm.
But again, trying to build in the language that actually this time period is extremely vulnerable. When you think about all the layers, it makes a lot of sense that, it might trigger disordered eating or an eating disorder. So really just highlighting that this is a really vulnerable time.
Mhm. And I think also important to get help if you are struggling because it's so important and it's not necessarily something that we're taught like what we need to eat to make our babies healthy. So being willing to get help with a dietitian like yourself,
Mhm.
I think could be very useful for most of us and especially for someone who's in recovery from an eating disorder.
Absolutely.
Well,
Yeah.
thank
And
you. Thank you again for being on the podcast. And I will be putting your contact information in the show notes so people can contact you if they would like to follow up. And I appreciate all your wisdom and knowledge. Thanks
thank
again.
you. So thank you for having me.